Hello, my name is Dr. Brian Raid, and I'm a naturopathic doctor. And this is a video about the relevance or the potential relevance of having a chronically sore throat or a recurring sore throat when there are other chronic health issues going on. So, of all the patients that I've treated who have chronic fatigue, chronic pain, brain fog, neurological symptoms, headaches, all these systemic issues that are just really, really problematic and debilitating. It's very, very rare that they come in saying, "Yeah, I have all this chronic stuff going on, and I've got a sore throat as well that comes and goes. Like every few months, I have, or every few weeks, I get a sore throat, or every couple of months, I get a sore throat, or I have this like just chronic sore throat that's been going on." It's really rare that they say the sore throat is their biggest concern. Usually, it's something that it's relatively rare that it even comes up in conversation during our intake, except when I look at their intake forms and I bring it up myself saying, "Oh, I see you checked off here that you have a chronic sore throat." And so then we talk about that. But it's very rare that they seem to care a lot about it, because I know myself personally, as much as I don't like having a sore throat, I would much rather have a sore throat and not be chronically fatigued and brain foggy and chronic pain. So it's not something that's necessarily given a whole lot of attention by patients, but it is something that can be really, really relevant. There are different microorganisms that can reside in the back of the throat, whether they're just free floating there in the back of the throat or maybe existing behind biofilms. Strep is one of the most common culprits that can potentially have an overgrowth issue in the back of the throat. And what I found is that in some patients who are suffering from chronic illness, they don't get better, or they don't get over a plateau of improvement until their throat is treated in some way, shape, or form. So what I mean by that is, say they're improving in terms of their energy and neurological symptoms, pain, etc., with their herbs or their IV therapies or their pharmaceuticals or whatever it is, but then they hit a plateau and they get kind of stuck. And sometimes it's not until we treat that sore throat that the plateau is overcome. So in terms of how that treatment can be done, it's really nuanced. It depends on the individual patient and what's going on with their particular case, and how concerned we are about the possibility of poking the hornet's nest and causing a big flare-up if we go too aggressive with the treatment approach, with a given treatment approach. But what I found is that the most useful tools are either working with some type of a throat spray, like an antimicrobial throat spray, or working with low-dose immunotherapy or some analogous type of immunotherapy. Low-dose immunotherapy is something that can be very, very effective for addressing underlying chronic or recurring strep issues or other microbes that might be residing or causing recurring issues with a sore throat as well. Now, sometimes a chronic sore throat isn't due to microbes or an issue with the back of the throat itself. It may be that it's from postnasal drip secretions, could be related to mycotoxins that are dripping down and creating some tissue irritation, could be a form of silent reflux. Like, there are various things that can cause a sore throat, and that's why it's not always a clinically relevant thing, but sometimes it really is. So just something to think about. And if you're an individual who's suffering with chronic illness, not all the way better yet, it is something worth maybe mentioning to your clinician if it hasn't been discussed or hasn't been addressed. If your case is somewhat plateaued, if you're in the midst of a treatment protocol, if things are going great, why mess with a good thing? But it is something that's worth having on the radar, in my opinion and in my experience. So if there's any questions about this at all or anything else, by all means, please feel free to post in the comment section below, and I'll do a video response or a typed response to whatever that question might be, if I'm able to. The other thing I'll mention just before I sign off here is that on August 3rd, 2022. So if you're watching this after August 3rd, 2022, then you've missed the boat. But if you're watching this before August 3rd, 2022, I am going to be doing a live Q&A session on that date. That's a Wednesday, August 3rd. It's going to be at 12 p.m. Pacific time, 3 p.m. Eastern time, or 4 p.m. Atlantic time. And it'll be about a 45-minute session where I'll be just answering any questions that folks want to throw out there that relate to chronic illness. I mean, I would answer questions about other things too, but the chronic illness is really what I have the most knowledge about and most interest in talking about. So I think most folks who listen to my videos or watch my videos probably have a chronic illness interest as well. So to access that live Q&A, I'll be sending out a link to, it's going to be via a Zoom meeting. I'll send out that link to my mailing list. So if you're not on my mailing list and you'd like to be part of that live Q&A, then please sign up for my mailing list and you can be part of the live Q&A. To sign up for my mailing list, if you're watching this on Instagram, please go to my bio, and in my link tree that's in my bio, there's a link to get to the mailing list sign up. If you're watching this on YouTube or Facebook, then there's a link in the description below to sign up for my mailing list. So I hope to see many of you there, and please bring fascinating, interesting, difficult questions, or simple questions. I mean, you can throw me a bone once in a while too, but I hope to see you there, and I'll leave it there for now.